So, today we're going to talk about a life saving drug that's basically a highly trained assassin for deadly fungi. But here's the catch: this assassin has a really, really specific rulebook. And if you break those rules, well, that can be even more dangerous than the threat you're trying to stop. Its name is Voriconazole. I mean, just think about this for a second. What happens when a dangerous mold, the kind you might find out in the world, starts growing not on a wall, but inside someone's lungs, or even their brain? It sounds like something out of a horror movie, right? But this is a very real, very life-threatening situation called an invasive fungal infection. When things get that serious, you can't just throw anything at it. You have to call in a specialist. And in the world of antifungal medicine, voriconazole is that specialist. It is incredibly good at its job, but it comes with this complex set of rules that doctors have to follow with, absolute precision.
Okay, so let's start with the problem itself. We're talking about these invasive fungal infections, and the main villain of our story today is a particularly nasty mold called Aspergillus. Now, for most of us, it's not a huge deal, but for someone with a weakened immune system, an Aspergillus infection can be completely devastating.
And this is where our hero drug makes its entrance. Voriconazole isn't just one option among many. No, it is considered the, and I'm quoting here, cornerstone of therapy. It's the first thing doctors reach for, the go-to weapon to fight this invisible invasion.
So, how does this fungal assassin actually get the job done? Well, its strategy is pretty brilliant, actually. It doesn't just launch a frontal assault on the fungus. It's much smarter than that. It sabotages the very foundation of the fungus's fortress from the inside out.
To really get how this works, you just need to know about one molecule, ergosterol. The easiest way to think about it is like this. Ergosterol is the key structural brick that fungi use to build their cell walls. It's what gives the whole cell its strength, its integrity. So no ergosterol, the whole structure is basically toast. So check out this 5-step takedown. First, voriconazole slips inside the fungal cell. It finds the architect. That's the enzyme in charge of making all those ergosterol bricks. Then, it basically just shuts down the whole operation, stopping brick production completely. And as an added bonus, this causes all this toxic stuff to build up inside the cell. The wall gets weaker and weaker until it just fails, and the fungus can't grow anymore. Game over. It's a total structural collapse.
But here's where that rulebook starts to get really, really complicated. Once the drug is inside our bodies, its journey is anything but straightforward. Actually, it's wildly unpredictable, and it's completely different from one person to the next. Now, on the surface, everything looks fantastic. You can take it as a pill, and your body absorbs it really well. It gets everywhere it needs to go, even into the brain, which is great. But the twist, the whole game changer, is right here, metabolism. It's processed in the liver by one specific enzyme, CYP2C19. And this is where your personal genetics crash the party.
This is so fascinating. It turns out we all play this kind of genetic lottery when it comes to processing this drug. Think of your liver as a drug processing factory, and that CYP2C19 enzyme is your workforce. Some people are poor metabolizers. Their factories like understaffed and slow, so the drug builds up and up to toxic levels. Then you have rapid metabolizers on the other end. Their factory is so efficient it clears the drug out way too fast, meaning it doesn't have a chance to work. And then there are the extensive metabolizers, whose factory speed is, just right. And all that variability in drug levels, it leads us straight to our next big complication, the danger zone of side effects. This is where the drug can cause some serious, friendly fire against the patient's own body.
Let's just start with this number, because it's pretty wild. Around 30% of patients experience the most common side effect, which is visual disturbances. Think about that. That is nearly 1 out of every 3 people taking this drug.
So these visual changes can be things like blurred vision, being really sensitive to light, or even seeing colors differently. But that's not all. It can also mess with the liver, which is why patients need constant monitoring. It can cause these really nasty skin reactions to sunlight, so sunscreen becomes absolutely essential. And if the drug levels get too high, it can cause some serious neurological issues like confusion or even hallucinations. All right, and there is one last huge rule in the book we need to cover. Voriconazole, well, it's not a team player. It has a super long list of really dangerous interactions with a ton of other common medications. Here's the critical point. Voriconazole is a powerful inhibitor of those very same liver enzymes we were just talking about. What that means is it can slam the brakes on how the body processes other drugs, so their levels can shoot through the roof. Combining it with certain drugs, like sirolimus, absolutely forbidden. And for a whole bunch of others, like the common blood thinner warfarin or cholesterol drugs, it means doctors have to monitor the patient like a hawk. This checklist is non-negotiable. Okay, so with this genetic lottery, the laundry list of side effects, and all these dangerous drug interactions, how on earth do doctors manage to use this fungal assassin safely and effectively? The answer, in one word, is precision. The secret weapon that makes it all possible is something called therapeutic drug monitoring, or TDM for short. The idea is actually pretty simple. You just take a blood sample from the patient and measure the exact concentration of voriconazole. This lets doctors perfectly dial in the dose, letting them walk that tightrope between the drug failing and the drug becoming toxic. And this chart just illustrates that balancing act perfectly. There's a very specific target that clinicians are aiming for. It's called the therapeutic window. You can see it right here. If the drug level is below 1.0, there's a good chance the treatment just won't work. But if it creeps up above 5.5, the risk of those nasty side effects, especially the neurological ones, goes way, way up. That little sweet spot right in the middle, that's the goal.
So in the end, it really all boils down to this. Its successful and safe use hinges on a thorough understanding of these properties, vigilant monitoring, and careful management. What that means is, the drug's incredible power has to be perfectly matched by the incredible expertise of the people who use it.
You know, the story of this one drug tells us something much bigger about medicine today. Voriconazole, the fungal assassin, is a perfect reminder that our most powerful tools aren't magic bullets. They're precision instruments. And the real breakthrough isn't just inventing the tool, it's mastering the knowledge of how to wield it with absolute precision. So it leaves you with a question, right? As we develop more and more powerful tools in every part of our lives, what other ones demand that we not only be powerful, but also be wise?